Hello, my name is Lena Santos, and I am a student at EKU in the Psychiatric Mental Health Nurse Practitioner program. Today, I will be presenting my integrative review. The purpose of this integrative review is to address the healthcare problem of medication non-adherence in adult patients with mental health illness. Non-adherence to medications can lead to serious risks to the patient's health and well-being. Per the U.S. Department of Health and Human Services in 2014, these risks include alcohol or drug abuse, violent or self-destructive behavior, and suicide. Additionally, non-adherence can result in relapse, hospitalization, incarceration, or even death by homicides or suicides. According to the U.S. Department of Health and Human Services in 2014, suicide is the 11th leading cause of death in the United States for all age groups, and the second leading cause of death among people aged 25 to 34. According to the Agency for Healthcare Research and Quality in 2014, only 50 to 60% of patients treated for schizophrenia follow their medication regimen for an extended period, increasing their risk for hospitalization. And nearly 1/4 of all adult stays in the U.S. community hospitals involve depressive, bipolar, schizophrenia, and other mental health disorders or substance use related disorders. With the data and statistics to support the problem, 2 studies were reviewed to evaluate the effect of multidimensional intervention compared to usual care on medication adherence in adult patients diagnosed with mental health illnesses. Study 1 was a non-randomized controlled trial by Polly et al. In 2015. The study was conducted on 269 adult patients who were taking at least one medication for a psychiatric diagnosis. The study took place on a psychiatric ward in Germany with a duration of 6 months at the ward and 3 months after discharge. The patients were divided into 2 groups, the intervention group and the control group. The intervention group received the multidimensional program, including individualized psychoeducation, focusing on simplified drug regimens and diagnosis and medication counseling, as well as follow-up motivational phone calls. The control group received usual care, which consisted of daily medication administration, general non-individualized education, and a medication leaflet upon the patient's request. The results of Study 1 were measured using the Medication Adherence Report Scale, or MARS for short, in which higher scores indicated more adherence. The results demonstrated increased MARS scores in the intervention group and decreased MARS scores in the control group. Study 2 was a randomized controlled trial by Pakpour et al. In 2017. The study was conducted on 270 adult patients with bipolar disorder who were taking a mood stabilizer. The study took place at 10 outpatient centers in Iran over a 6-month time frame. The patients were divided into 2 groups, the experimental group and the usual care group. The experimental group received the multifaceted intervention, including motivational interviewing and psychoeducation. The family of the patients were invited to take part in the interventions. The usual care group received only pharmacologic treatment and standard follow-up visits. The results of Study 2 were measured with the MARS scale and mood stabilizer plasma levels. MARS scores were significantly greater in the experimental group than the usual care group, and mood stabilizer plasma levels were also significantly greater in the experimental group than in the usual care group. The results in both studies showed significant improvement of patients with psychiatric diagnoses in medication adherence using the multidimensional intervention. The proposed intervention is to use a multidimensional or multifaceted approach to promoting medication adherence in the psychiatric population. The multidimensional intervention would incorporate a multidisciplinary team focusing on, but not limited to, pharmacologic treatment, psychoeducation to help the patient understand their diagnosis and medications, individualized care, focusing on simplified drug regimens tailored to the patient's needs, and motivational interviewing, which focuses on decreasing resistance and increasing adherence to medications by assessing factors that facilitate or inhibit their adherence. The advanced practice nurse could best apply the multidimensional approach in an outpatient mental health clinic, whereby patients are likely transitioning from an acute inpatient setting back to the community. During this time, patients are discharged with either an established or a new diagnosis and a new or revised treatment plan. The advanced practice nurse would find this a critical point in the patient's transitional period because of their vulnerability to treatment non-adherence that could lead to potential negative outcomes. Thus, the advanced practice nurse would best initiate multidimensional intervention at that time to ensure the patient has the appropriate resources and maintains those resources to facilitate medication adherence and promote overall health and well-being. This concludes my integrative review. Please feel free to email me with any questions or comments. Thank you for watching.